Hearing you have a thyroid nodule can be unsettling. It's a small lump in a small gland, but it can bring big worries. Many people immediately think of surgery. They worry about a scar on their neck. They fear the risks that come with any operation. And perhaps the biggest concern is losing the thyroid gland itself. This gland is a powerhouse, controlling your body's energy and metabolism. The idea of living without it and needing medication for life can feel overwhelming. These fears are completely normal and valid. It is important to face them with good information, not with anxiety. Understanding your options is the first step toward peace of mind. Let's start with a crucial fact. A benign thyroid nodule is not cancer. The word benign means it is non-cancerous. These growths are very common, and most of the time, they are harmless. However, they can be a source of discomfort and anxiety. The first step after a diagnosis is usually a biopsy to confirm that the cells are indeed benign. Once you have that confirmation, a weight is often lifted. You can take a deep breath. This diagnosis means you have time. You have more choices. You are not on an urgent path to the operating room. Now you can explore what is best for you and your body. The journey begins with a conversation with your doctor. It's important to understand why the nodule formed and what it means for your health. These nodules are simply overgrowths of thyroid tissue. They are not a sign that you did anything wrong or that your body is failing. They are just something that happens to many people. Knowing this helps to demystify the condition. Instead of seeing it as a scary medical problem, you can view it as a manageable situation. Your doctor will monitor the nodule with regular ultrasounds to see if it is growing or changing over time, which is a key part of the process. Feeling anxious about a visible lump in your neck or the potential for surgery is natural. But remember, knowledge is power. The more you learn about your condition, the more in control you will feel. Your thyroid journey doesn't have to be defined by fear. It can be a path of informed decisions. You can work with your healthcare team to find a solution that fits your life and your comfort level. You have many options, from simply watching and waiting to exploring newer, less invasive treatments. The goal is to manage the nodule while preserving your quality of life and, whenever possible, your thyroid function. One of the common questions people ask is why a benign nodule would get bigger. It can be confusing. If it's not cancer, why doesn't it just stay the same size? Benign nodules are made of active thyroid tissue, and like any tissue, they can grow over time. This growth is usually very slow, happening over several years. It doesn't mean the nodule is turning into something more dangerous. It is simply the nature of these growths. For this reason, your doctor will recommend regular checkups. Monitoring the nodule with ultrasounds helps track its size and ensures that nothing has changed. This watchful waiting is a very safe and common approach for small, symptom-free nodules. So when does a growing nodule become a problem? The issue arises when the nodule gets large enough to cause symptoms. Your thyroid gland sits at the base of your neck, a very busy neighborhood for important structures. A large nodule can start to press on your windpipe or trachea, making it feel difficult to breathe, especially when lying down. It can also push against your esophagus, the tube that carries food to your stomach. This can lead to trouble swallowing, a feeling of a lump in your throat, or even choking on food. These are called compressive symptoms, and they are a clear sign that the nodule is starting to affect your daily life. Beyond the physical discomfort, a large nodule can also cause cosmetic concerns. A visible bulge on the neck can make people feel self-conscious. You might find yourself wearing scarves or high-collared shirts to hide it. This can take a toll on your confidence and well-being. It is important to acknowledge that how you feel about your appearance matters. Your doctor should take these concerns seriously. A treatment decision isn't just about medical necessity, it's also about your overall quality of life. If a nodule is making you unhappy or uncomfortable for any reason, it is worth discussing your treatment options. This is often when the conversation about surgery comes up. Traditionally, surgery or thyroidectomy has been the main solution for large, symptomatic benign nodules. Removing part or all of the thyroid gland permanently solves the problem of the lump. It also provides a complete sample of the tissue for analysis, removing any tiny lingering doubt from an initial biopsy. However, surgery is not the only answer anymore. For patients who want to avoid an operation, there are now excellent, less invasive alternatives that can provide relief without the need for a single incision. It is a new era for thyroid care. For many people worried about surgery, radiofrequency ablation or RFA is a game-changing option. Think of it as a highly precise, non-surgical way to shrink a nodule from the inside out. It's a minimally invasive procedure that can be done in an outpatient clinic, meaning you can go home the same day. You don't need general anesthesia, just local numbing medication. This approach is specifically designed for benign, solid nodules that are causing symptoms or cosmetic issues. It offers a powerful alternative for those who are not good candidates for surgery or simply wish to avoid it. RFA is about solving the problem without creating a new one. Here's how it works in simple terms. A doctor, usually an endocrinologist or an interventional radiologist, uses an ultrasound to get a clear picture of the nodule. Then they guide a very thin needle-like probe directly into the center of the growth. This probe emits radiofrequency energy which generates heat. This targeted heat destroys the nodule's tissue, causing it to break down. Your body's natural cleanup crew, the immune system, then gradually absorbs the treated tissue over the next few months. The result is that the nodule shrinks significantly, often by 50 to 90% over a year. The process is precise, protecting the healthy thyroid tissue around the nodule. The benefits of RFA are significant. First and foremost, it preserves your thyroid function. Because the healthy parts of the gland are left untouched, most people do not need to take thyroid hormone medication after the procedure. Second, there is no neck scar. The probe is inserted through a tiny puncture in the skin that heals without a trace. The risk of complications, such as damage to the vocal cord nerves, is also much lower compared to surgery. Recovery is quick. Most people can return to their normal activities the very next day. It is an effective way to relieve symptoms and improve appearance with minimal disruption to your life. Of course, RFA is not for everyone. It works best on nodules that are confirmed to be benign and are mostly solid. For nodules that are filled with fluid called cystic nodules, another simple procedure called ethanol ablation is often more effective. This involves injecting sterile alcohol into the cyst to shrink it. The key is to have a thorough evaluation by a specialist experienced in these techniques. They can determine if you are a good candidate. For the right person, RFA offers a safe and highly effective path to relief, allowing you to keep your thyroid and avoid the operating room altogether. Making a decision about your thyroid nodule is a personal journey. It involves weighing the pros and cons of each approach with your doctor. While options like RFA are incredible breakthroughs, it's also important to be reassured about traditional surgery if it becomes necessary. Sometimes a nodule is simply too large or its location makes other treatments difficult. In these cases, surgery is a very effective and safe procedure when performed by an experienced surgeon. If part or all of your thyroid is removed, life afterward is very manageable. You would take a daily hormone pill to replace what your thyroid used to make. This pill is simple, safe, and effectively restores your body's normal hormone levels. Many people live full, healthy, and active lives without their thyroid gland. Finding the right dose of medication can sometimes take a few adjustments, but once it is stabilized, you likely won't feel any different. The fear of being dependent on a pill for life is understandable, but it is often much simpler than people imagine. It just becomes a normal part of your morning routine, like brushing your teeth. Knowing this can help reduce the anxiety around a surgical decision. It means that even if surgery is your best or only option, you have a clear and positive path forward. Your health and energy can be fully maintained. The most important step in this process is open communication with your healthcare team. Don't be afraid to ask questions. Write them down before your appointment. Ask about all your options: watchful waiting, RFA, ethanol ablation, and surgery. Discuss your personal goals. Is your main concern avoiding a scar? Are you most worried about preserving your thyroid function? Or is your top priority getting rid of the lump and its symptoms as quickly as possible? The best treatment plan is one that aligns with your medical needs and your personal preferences. If you ever feel unheard or unsure, seeking a second opinion is always a wise choice. Ultimately, you are in the driver's seat of your health journey. A benign thyroid nodule is a manageable condition, not a life sentence of worry. With modern medicine, you have more control and more choices than ever before. Whether you choose to monitor the nodule, shrink it with a minimally invasive procedure like RFA, or opt for surgery, there is a path that can lead you to a resolution. Talk to your doctor, gather your information, and make the choice that feels right for you. You can move past the worry and get back to living your life, confident in your health and your decisions.